What's up, YouTubers? This is part two, as I said before, using and beginning feminizing, wow, medications, part two. If you're first checking my site, video channel, welcome. My name is Riley. I'm transgendered, and I've been doing a lot of subjects, and we're just going to keep moving with these subjects. I greatly appreciate each and every one of your comments. The Q&A video was awesome. As I said before, it was wonderful. I got so much feedback. Thank you very much. And any more than that, I'm going to begin where I left off in the feminization and the medications, beginning and taking them. Okay. Know that you should stop taking estrogen 2 weeks before surgery or when you're immobile for a long time. This will lower the risk of getting blood clots. Know that you can start taking it again a week after when you're back to normal and your doctor, your therapist, endo, and all that says you're good to go. Okay? Know that using these medications to appear more womanly is an off-label use. Know that this means it is not approved by the government. Know that these medications does that is recommended and based on the judgment and experience of your clinic, doctor, endo. Know that you can choose to stop taking these medications at any time. Know that if decided that you do this, and I was over this earlier. I just cannot talk today, huh? Because it's daylight. That's what it is. Because I'm always doing this at 2, 3 in the morning. Moving along. Anyway, uh, if you decide to do that, you should talk to your clinic, your doctor, and everything, and help make sure that there are no negative reactions. Know that your clinic may suggest you to cut back doses or stop taking it all if certain conditions develop. This may happen if the side effects are severe. There are health risks that you cannot control. Some of your alternatives are using the medication to help people appear more womanly, um, or manly if you're doing the opposite of this. Let me get that out there right now. Like I said, I've done my homework, but some of this is kind of, it keeps repeating itself, but we're going to keep going. Okay. Anyway, let's see. This will help make sure that there are no negative reactions. You also know that your clinic, your doctor, and all suggest for cut back and everything like that, as we said earlier. I would not recommend just cold turkey. I'm not a doctor. I'm just saying I would not recommend. I would be more like talk to your doctor and ask if the levels can be lowered each week as they do with other medications until it's low enough for you to just stop. If you decide to quit doing the feminization medications or HRTs, hormone replacement therapy medications. And as I was saying, with the alternatives, you just talk with your clinic and everything to know if you're going to do or if you're not going to do it anymore. Um, the physical. Your first change will probably notice that your skin will become a bit drier and thinner. Your pores will become smaller, and there will be less oil and product in your face, becoming more prone to bruises or cuts. Trust me, I know this one. You may notice and perceive a pain, temperature difference, or just feel different when you touch your skin. You will probably notice skin changes within a few weeks. Mine was almost instantaneously, literally. But like I said, it's different for each body, okay? I'm not saying that this is going to happen overnight. And then again, it might. It's just how your body is and how your body relates and reacts to the medication, pretty much. And notice, and this is another thing too, I hate it, but A lot of you that's on the medication know this. Basically, your sweat and your urine will change. Sometimes it gets lighter, sometimes it gets more odor, pretty much. Um, Notice you'll have small buds developing between beneath the nipple part. It'll be like little knots, not like, I'm sure you know what I'm talking about. If you don't, it'll be like these little small knots that start. And they were sore for me. I'm not saying they're sore for everybody, but they were sore for me. I was sore for a while, and it kind of scared me, so I went to my doc, and he basically told me that your breasts are developing at a pretty good rate. So it is what it is. Um, Moving along. Now the pain will diminish over several months. The breast develop is quite vulnerable from person to person. Like I said, some it hurts, some it don't. Not everyone develops at the same rate. Most transgender women can only expect to develop an A. I gotta be 36. I got lucky. Plain and simple. And it does say perhaps a small B cup. Um, Only after many years of hormone therapy, the breast of a transgender woman varies shape and size. Something different shape between the right and the left. Like one might be a little bigger, one might be a little smaller. They're not going to be totally perfect. I'm going to let you know that now. Only way you get perfect breasts is when you have them cut you open and put them little packs inside. Then you have perfect breast. And if that's your choice, au festiva. Your weight will begin to reduce around your body. Fat will begin to collect and it'll move around your hips and thighs, under your skin, throughout your body. Hormones will have a different and significant effect on the fat in your abdomen area, otherwise known as your girl gut, or as I call it, my pancake pooch. Anyway, um, your muscle mass will decrease. It does. You get smaller. And your definition is more of a smooth appearance. Um, um, and your strength will your strength will decrease. Maintaining muscle tone as well as general health is a good idea, depending on your diet, lifestyle, genetics, starting weight, and muscle mass you may gain, lose because of being on the HRTs, or the, as others say, feminizing medications. The fat under your skin in your face will increase a little. It did for me, especially up in this area and around my cheekbones and around the eye area. Facial in general, more female appearance. Please note that your bone structure, hips, arms, hands, legs, feet, etc., etc., they won't change. The facial changes can take up to 2 years or more to see your final results. Usually a good idea to wait at least 2 years after beginning your HRTs before considering drastic facial feminization products. Your hair on your body, such as your chest, back, arms, will decrease in thickness and will grow a lot slower at a slower rate, which I told y'all I don't have that much hair in the first place, so it's almost obsolete for me. I'm not saying it'll do that for you, so don't come back and be like, Riley, you said no. Listen to me. I don't have that much hair. I've never had that much hair. I do have a lot of feminine qualities from the get-go, I guess you say. I was just lucky born that way. But anyway, um, going into the emotional state, oh my God. When I started this, I was crying. I was raging sometimes. It all differs, and overall in your emotion and your state may not change that much. It varies from person to person, of course. Puberty is a roller coaster of emotions. Y'all know this. I know this. Everybody knows this. This is actually your second puberty you're going through. No matter what the age, for somebody over 40 and up, it's going to be a lot slower. I'm going to be honest with you, it is. It's going to be a lot slower because your body slowed down, yada, yada, yada. I'm no doctor. I'm just telling you from a doctor's point of view of what they explained to me when I started my HRTs long, long ago. It's kind of scary, to be honest. But, you know, anyway, you might need a support group. You might need a therapist. Check into that. If you're depressed a lot, please check into that. Please, please, please. I was hard headed. I didn't. Okay? So that's pretty much on your emotions. Your sexual hormones and treatment. Soon after beginning your hormone treatment for your sexuality or sex, it will decrease in the number of erections that you have when you do have an erection. It'll be less firm and will not last as long. Listen to this. You may lose the ability to penetrate. You may still have the erotic sensation and still be able to orgasm. However, when you do orgasm, it may be dry. In other words, you can't do the baby batter thing. And it's in different parts of the body to bring erogenic pleasure. Your orgasms will feel different. Oh, yeah. Oh, yes. With more of a whole body experience, less peak intensity, and long duration. Um, I'm not going to say that word anyway. Um, I'm not even going to say that either, to be honest with you. But you could basically use toys too, and still get your erotic sensation. Let's leave it at that. Okay. Uh, your testicles are going to shrink. Yeah, they're going to shrink. They sure are, from the original size or less. In normal cases, it doesn't affect the amount of scrotal skin available for future genital surgery if you decide to have the surgery. I say that is because I've told y'all before, I fear the surgery. I don't want the surgery. I am who I am. Same with my voice, same with my look. This is me. I love me. I go out, I do things, and I enjoy myself. Love me or hate me. When I walk into a room and I leave that room, you're going to say something. You're not going to say it to me, but you're going to say something, good or bad. You're going to remember I was in that room because I'm that type of individual. I'm loud, I'm outspoken, and I am who I am, and I enjoy every day of it. Oh my God, I love it. I just love being me. That's just the bottom line. Moving along. Reproductive area. Basically, with a hormone therapy, it is permanent and irreversibly sterile. Basically, when you do these hormones, before it's over with, it will become permanent. You won't be able to get your hard on. You won't be able to do the dry. You'll do the dry thing. It won't be a liquid. Okay, and we'll leave it at that. I might have to put 17 and above on this one. Anyway, we're moving into the estrogen part to explain it. The estrogen and hormone responsibility is a physical change, an emotional change, and either it's given in pill, injection, or even a gel, or even a gel. You can apply it to your skin with the gel. You could take the pill, of course, or you could do the injection. I choose the injection, even though it hurts. Now this is the part that's kind of. This is the reason that I only do the spiral pill because they really don't have spiral in a needle yet, and I don't think they'll ever do that. But when you do a lot of pills, it weighs heavy. It weighs heavy on your liver. Okay, it makes your liver work even harder. To be honest, this is why I try to do everything in the needle that's humanly possible. Risk and associations with estrogen is high blood pressure, blood clots, liver problems, strokes, diabetes, other potential unknown risks. Since they do not do enough research on all of this, then in the future there could be more risk or more side effects of what I just told you. Um, a very small amount of the estrogen needed to deliver it gives a maximum effect. So if you're like, oh my God, he just gave me 5 milligrams, that might be all you need. That might be all you need. You allow your doctor to decide on the milligrams. Don't do it yourself. Like I said, if you self-medicating after this, I don't know what to tell you. I have told you to get an endo. I have told you to talk to a doctor, and that's all I can say. I can't force you, but after all of this, it might register with the ones that are deciding to go the route without a doctor and go the route to get their estrogen and all that offline, which you can. I wouldn't recommend it, but yeah, you can. Matter of fact, I'm saying don't. To be honest, get you a doctor. Make sure that everything's good on this. You don't want a bad experience from this. Trust me, one bad experience from it, and it could be fatal. Just to believe. And there is certain risk, the prostate, honestly, female breast cancer, between, especially, in the beginning between 40 and 50, who are on the hormones, 2 or 3 years. So you got to check your prostate. You got to check your breasts. Okay. If you don't know how to do that, there's a technique to where you move your hand around your breast and you feel for lumps. Okay. Excuse me. I recommend it to a transgender woman or to a GG. Okay. I recommend it. Make sure that you have breast exams. Make sure that you go to them and make sure they get done. They're painful. Some makes you kind of feel like your doctor's groping you up, and it's a little embarrassing. But I'd rather be in a little pain, and I would rather be embarrassed than my doctor tell me you have breast cancer, Riley, and now we got to cut off one of your. You know, anything can happen. So make sure you're doing that. Please, please, please. With a testosterone blocker, the drugs actually block your testosterone. It doesn't completely kill it like everybody thinks, but it blocks it. You're gonna have a little testosterone. Women have testosterone. Men have testosterone. Okay, so and the side effects, could make you urinate excessively, um, especially after you first start taking it. Dizzy or lightheaded. Always drink fluids. Always drink water. Always drink Gatorade. These are my things. Always drink Gatorade. Always drink a lot of fluids. Keep a lot of fluids in you because, excuse me, I'm so sorry. Um, when you're taking the medication, especially spironolactone, can interact with the blood pressure medication and can be dangerous in people with kidney problems. It is important to share the full medical history. Of course, you know that. And if not, please share your medical history with your doctor and your endo so they can look into it. Progesterone is a source in consistent inconsistent the trans woman and provides progesterone has a number of reported benefits such as mood, energy, and libido, better breast development, better body fat, and redistribution on your curves. Okay? Wow. I'm actually over. Well, that's pretty much it for part two. Thank y'all for watching. I hope that this very much helped. Down below, you can comment and you can let me know, if you liked it, if you didn't like it, or if I'm on the wrong track here. Please, I did my homework. I talked to my doctors. I am not a doctor, okay? But I've been taking my medication for a very long time. And I will tell y'all that, yes, I am doing the progesterone too, but I do that every 60 days. You're wondering why? It's different for everybody. But any more than that, I love each and every one of you. I'm so pressed for time. I hope they let me air this. And if you're doing hormone therapy on your own, stop. Get you a doctor. If you smoking cigarettes, know your risk while you doing your therapy and your hormone medication. And I don't mean therapies and the doctor. I mean your therapy, hormone medication. Any more than that, I love each and every one of you. I hope that this video was very beneficial to each and every one of you. And as always, deuces. Bye.